The nerves supplying the lower limbs are derived from the lumbar and sacral plexuses. These plexuses are not as complicated as the brachial plexus. Keep in mind the general points made regarding plexuses in the upper limb innervation video. There are lots of similarities between the two. The lumbar plexus is formed by the ventral rami of L1, 2, 3 and 4. It is located in the substance of the psoas major. Two large nerves, femoral and obturator, arise from this. Both these nerves contain fibers from L2, 3 and 4. The difference is that the femoral is from the posterior divisions while the obturator from the anterior divisions. The sacral plexus is formed by the ventral rami of L4 to S4. It is situated in the pelvis, closely related to the piriformis. All its branches exit the pelvis via the greater sciatic foramen to enter the gluteal region. Its main branches are gluteal, tibial, common fibular and pudendal. It is time to look at some specimens. I will start with the plexuses and then follow the main branches. We are looking at the posterior abdominal wall in body 1. I'm sure you recognize the psoas major and the iliacus. For orientation, this is the aorta. Here is its bifurcation. This is the inferior vena cava. These two are the vessels which keep the world going. These, by the way, are the testicular vessels. Here is the kidney. Coming down from that is the ureter and then leading on to the bladder. On this side, the psoas major has been resected, so you can see these roots of the lumbar plexus right in here. Lying on the lateral side of the psoas is the femoral nerve, and as this femoral nerve comes down the iliacus, it supplies it, and then it goes deep to the inguinal ligament to come into the thigh, where we'll follow it later. This thin nerve coming down across iliacus is the lateral cutaneous nerve of the thigh. It pierces the inguinal ligament close to anterior superior iliac spine and then comes on to supply the skin on the lateral side of the thigh, hence its name, lateral cutaneous nerve of the thigh. Remember, this is not a branch of the femoral, though some people call it lateral femoral cutaneous. It comes directly from the lumbar plexus. As it lies close to this anterior superior iliac spine, during surgery it may be damaged or irritated by the retractor which rests against this spine. The other large branch coming from the lumbar plexus is the obturator nerve. The obturator nerve lies medial to the psoas major and gives no branches in the pelvis. As I move this artery to one side, you can perhaps see the obturator nerve accompanied by the obturator artery leaving the pelvis via this small opening, the obturator foramen, to enter the thigh. This other structure that is going across that I am holding now is the vas deferens. We are looking at the anterior aspect of body 3. Can you recognize these two nerves? And as we look inside the sacrum, here I am pointing to the piriformis, and along with that there are the roots of the sacral plexus. This big hole that you are seeing there is the greater sciatic foramen. Going out through that, This big one is the sciatic nerve. I'll rotate the specimen to follow the nerves in the gluteal region. This here is the greater sciatic foramen. Here is the cut edge of the piriformis, this being the other edge. This nerve, which generally comes above the piriformis, is the superior gluteal nerve, and it supplies this muscle that it is lying on. Can you name the muscle? It supplies the gluteus minimus and the gluteus medius, which is the cut edge here, and another muscle this nerve supplies is the tensor fascia lata. Coming below the piriformis, this big nerve is the sciatic nerve. Another nerve lying next to the sciatic, just coming over this ischial spine and then disappearing out of sight. It goes to supply the external genitalia, and this is the pudendal nerve. It will be described in another recording. Also note this tendon going across over here. This is the tendon of the obturator internus, and the nerve that supplies the obturator internus comes from the greater sciatic foramen, goes across like this and supplies the obturator internus on this aspect over here. I'll turn the specimen a little more so we can see the structures on the other side. On this side, here is the superior gluteal nerve, gluteus minimus, gluteus medius, and this is the piriformis. But look how different it is from the other side. These two nerves, these actually are the two components of the sciatic nerve, the common peroneal portion coming down like this and the tibial portion. In this specimen on this side, the two components of the sciatic nerve are coming separately. The common peroneal part is piercing the piriformis to come on this side, whereas the tibial portion is coming below. There are variations in the way the sciatic nerve enters the gluteal region. Sometimes one part will come above the piriformis and one below, or other times the whole nerve could come through the piriformis. Remember, the sciatic nerve is just these two components held together by a fascia, and generally the sciatic nerve divides into its two components about mid-thigh, but here they're coming separately to begin with. Next, I'll point out the entire length of the spinal cord and its coverings. In the cervical region, the spinal cord is covered by the dura, and then you can see that in this region the dura has been cut and reflected so that you can see these dorsal roots. In fact, these little swellings that I'm pointing to, this one here is the dorsal root ganglion, and you can see that it is located at the level of the intervertebral foramen. As we come down, the spinal cord ends at the lower border of L1, but the canal still contains these nerve roots, which is the cauda equina, so called because it looks like a horse's tail. In the middle, this little thin bundle of fiber, which looks a little different, is the filum terminale. It connects the conus medullaris at one hand with the coccyx on the other. In this specimen, I want to point out two nerves, but before I do that, I want you to identify three structures: 1, 2, and 3. This, by the way, is the inferior gluteal artery, which was going to the gluteus maximus. This is the inferior gluteal nerve, and the only muscle it supplies is this massive gluteus maximus. You are not seeing the superior gluteal nerve, which comes above the piriformis, as it is hidden by the gluteus medius. The other nerve that you are seeing here is the posterior cutaneous nerve of the thigh. The rest of it has been cut, but what this nerve does is to supply the skin on the back of the thigh, extending all the way down into the popliteal fossa and almost reaches the calf. Now I will follow the tibial nerve. Here is the sciatic, and the tibial component of the sciatic supplies the hamstrings in the thigh. As I separate these muscles, you can see some of those branches. Here is a branch to the long head of biceps, and here is a branch to the semitendinosus, and another one going from here to the semimembranosus. As this tibial nerve comes down into the popliteal fossa, you can see that it is very superficial in this region, and then it's going to come down the leg and supply all the muscles in the posterior compartment of the leg. So in other words, it supplies the flexors of the knee, the ankle, and the toes. Here you can see its branch going to one of the heads of the gastrocnemius, and there is the one to the other head. The nerve then disappears out of sight by going deep to the soleus. Since many of the superficial muscles have been removed, it's easy to follow the tibial nerve. This is the soleus, which has been cut along here. So here the tibial nerve is going deep to it, then it's coming down here, supplying these muscles in the deep compartment, accompanied by the posterior tibial artery, and then as it enters the ankle, it is lying next to the tendon of the flexor digitorum longus, and at this point it divides into two branches, the medial and the lateral plantar nerves, which correspond to the median and ulnar in the hand. These plantar nerves supply all the muscles in the sole of the foot and the skin and the sole of the foot and the toes, and then turn up to supply the nail beds on the dorsum. It is time to follow the common fibular nerve. Here is the common fibular portion of the sciatic, giving a branch to supply the short head of biceps. That is the only branch that comes from this in the thigh. The common fibular nerve then comes down the thigh, and it goes around or winds around the neck of the fibula. It is at this point that the nerve is going to divide into two, superficial and deep branches. We'll do the deep branch first, which goes to the anterior compartment of the leg. The deep fibular nerve enters the anterior compartment and supplies all the muscles in here, which are dorsiflexors of the foot and extensors of the toes and an inverter of the foot. This one here is the extensor hallucis longus, and the tibialis anterior and the extensor digitorum longus. You're not seeing the rest as it has been removed. As the nerve comes down the leg, it then supplies this muscle on the dorsum of the foot, and this little muscle, the cut edge of the extensor digitorum brevis. The deep fibular also supplies the skin along the dorsum of the foot this way, and then comes to supply the skin on the adjacent sides of this first cleft. To follow the superficial fibular nerve, we are back to the right side of body 2. Here is the common fibular nerve, and as it is coming down here to go in the substance of the everters of the leg, at this point it can be rolled, as well as it may be compressed by a tightly fitting cast. It is the superficial fibular which supplies these everters, and then in the distal third of the leg it pierces them, comes out, and then gives many branches. it does go superficial to that retinaculum, and on the dorsum of the foot it supplies the skin on the dorsum and then gives branch to supply medial side of the big toe, the second cleft, the third cleft, and the fourth cleft. This brings us to the sural nerve. The sural nerve is a branch of the tibial. That part has been cut here, and it gets a branch from the common fibular as well. And sometimes one branch is bigger than the other. In this case, the contribution of the common fibular seems to be much larger. It generally lies between the two heads of gastrocnemius and accompanies this short saphenous vein down the leg, supplying the skin, coming down behind the lateral malleolus and supplying the lateral side of the foot and the lateral side of the little toe. I'll use this pelvis specimen to demonstrate the femoral nerve on the two sides. Starting with the right side, here is the femoral nerve coming out into the thigh below this inguinal ligament, and it is lying lateral to the femoral artery. Here it's going to give branches to the muscles which are flexors of the hip. This is a branch going to the sartorius. Here is a branch going to the rectus femoris, this other muscle, you can see it perhaps that way, and then it also sends a branch to supply the pectineus. This is a branch which is going to go further down to supply the skin and would follow it later. But it is at this point accompanying the femoral arteries or the femoral vessels down in this canal, which is called the subsartorial canal, as it lies deep to the sartorius. On the left side, we'll follow the branches of the femoral nerve to the other muscles in the anterior compartment of the thigh. This is the cut edge of rectus femoris. Here is the sartorius. The pectineus has been removed as well. And you can see that these are the branches coming to supply the vastae. In addition to these muscular branches, the femoral nerve here gives branches to supply the skin on the anterior part of the thigh, and this once again is that nerve which is the saphenous nerve that comes down in that canal quite deeply, and as it comes down to the medial side of the knee, it is there that it becomes quite superficial and accompanies the great saphenous vein all the way down the leg, going up to the medial side of the foot, up to the ball of the big toe. The other big branch from the femoral plexus is the obturator nerve, which leaves the pelvis via this obturator foramen to come into the thigh to supply the adductors and gracilis. The muscles that you are seeing here are, this is pectineus, there is adductor longus, and this is gracilis, and as I move this, you can see a branch coming to supply the gracilis. Between these two muscles, situated here is the obturator nerve. It is lying on adductor brevis, so it supplies that as well, and in fact it sends a small branch to the pectineus since it's lying in between that and the brevis. On the left side, since some of the muscles have been cut, you can see the obturator externus over here, and coming through this foramen, piercing this muscle and supplying it is this branch of the obturator nerve. This branch also then supplies the adductor magnus. This is the adductor brevis over here, and here is the cut edge of adductor longus, and the gracilis is on this side also been cut. In this specimen, the pelvic organs have been removed, so you can see the pelvic diaphragm, and as I tilt it, you can see the piriformis and the sacral plexus quite nicely. In the gluteal region on this specimen, I'd like you to identify a few structures and its nerve supply. The muscle is piriformis and supplied directly by branches from the sacral plexus within the pelvis. This here is the tendon of obturator internus. This nerve coming below the piriformis is the inferior gluteal nerve to gluteus maximus. These two nerves supply the two abductors of the hip. The nerve is superior gluteal, supplying the gluteus medius and minimus, and it's accompanied by this large artery, which is the superior gluteal artery. This, by the way, is the sacrotuberous ligament, which converts the greater sciatic notch into a foramen. Now, the last thing, as I point to my foot, I want you to think of the nerves supplying the area. The skin on this part of the foot, saphenous nerve, branch of femoral, the skin here on the sole of the foot, medial plantar, branch of tibial, the skin on this part of the foot here, deep fibular, branch of common fibular, and the skin over here, superficial fibular, branch of common fibular, and the skin on the lateral side of the foot as well as the little toe. Sural coming from the tibial and getting a contribution from common fibular. How about the nerve that supplies the muscle? You are seeing this tendon over here. The tendon is tibialis anterior and the nerve supply is deep fibular.